I will now take you through exercise as part of your routine. Generally, people are a bit concerned about how much to exercise, what kind of exercise to do, and generally, most of the healthcare professionals are a bit reluctant to even discuss this matter. So, diet and exercise, I am stressing, form the basic pillar in the management of diabetes. They are equally important as much as your visit to the doctor as well as taking the medicines. A reduction in blood pressure, cholesterol, your stress levels, and thereby the incidence of a heart attack are some of the well known benefits of exercise. However, it can also strengthen the muscles and the bones. It can also improve the posture and the balance of a person. It will help in reducing the visceral adipose tissue, which is the fat that one does not see from outside. It is the fat on top of the internal organs which can be seen inside. This is called the bad fat. The lesser of bad fat you have, better will be your longevity. The body mass may remain the same, but your visceral fat level can be quite high, and this will reduction in any amount of visceral fat, that is the bad fat, will help in overcoming insulin resistance, which is the curse of a person with type 2 diabetes. However, intense spurts of an exercise such as a quick sprint over a short period of time can increase your sugar levels because the body produces a lot of glucose to help burn the fuel for the excessive use of muscles. Always check the sugar before and after doing a heavy exercise. If your sugar levels are very low before the exercise, make sure you have either a sip of orange juice or probably 2 dates or a few raisins or even half a banana before your exercise. Otherwise, your sugar levels are going to come down pretty low. Avoid exercising late at night. Reduce the insulin dose before you go on an excessive exercise regimen, because the amount of insulin absorption will be quite fast and your sugar levels can drop down very fast. It's very important to hydrate yourself with enough fluids in between the exercise plan if you are planning to do exercise for more than half an hour. It's so easy to pick out an exercise regime, but make sure that your healthcare professional knows of what kind of exercise you are planning to do. It's always wise to undergo a comprehensive health checkup before you would decide on planning out a regime for yourself. You would need to do a cardiac evaluation, which would include a baseline ECG, an electrocardiogram, an echocardiogram, and a stress treadmill test. Make sure that there is no affection of the eye, that means the retinopathy, or a problem with your feet, that's called a neuropathy, and a blood vessel disease whereby you do not have enough blood flow down your limbs, or even a kidney problem. If you are told to do exercise, you might be surprised to know that there are some instances when doctors would recommend one not to do an exercise. So, if the sugar levels are above 300 milligrams generally, or if you have ketones in the blood, if you are a type 1 diabetic, the doctors would advise you to get that corrected before you start your exercise. If you are having retinopathy, you should have to discuss with your doctor before embarking on an exercise schedule. Any exercise plan that involves the Valsalva maneuver, whereby you have to lift excessive weights, is going to cause an increase in pressure in your blood vessels, which can cause further damage to the eye. There are conditions where you have severe peripheral neuropathy, whereby you're not able to recognize how much of pressure to give onto your lower limbs, and that can cause damage to the toes or even the feet. Those who have got advanced nephropathy, that means the diseases of the kidney, should be careful with their water intake. If you are having recurrent episodes of low sugar levels, you should be very careful while exercising. Generally, those with retinopathy should have a checkup with their eye doctor, and they should be usually advised exercises in an active form after 4 months of therapy. Those with peripheral neuropathy should avoid heavy exercises and should prefer exercises which do not cause weight bearing. Probably even cycling, swimming would be good exercises. Diabetic nephropathy, that means those with problems of the kidney, can impair the oxygen delivery to the muscles during the exercise time. Never inject insulin into a group of muscles used for exercise. Like if you are planning to go for a jog or for cycling, do not inject into the thigh muscles because it will be absorbed much quicker, thereby causing low sugar. If you are exercising outdoors, if the climate is very hot or it's very cold, it's very wise to dress appropriately and also to take enough of fluids or even light snacks with you. There are certain people who are on an insulin pump used for the management of diabetes. They should be reducing the dose of their basal insulin by at least 50% before embarking on an exercise regime. It is always wise to carry an ID card mentioning that you are diabetic. While exercising, it should be important to warm up for 5 minutes with doing active stretch exercises. Getting your body conditioned up, do the exercise and allow a similar 5-minute cooling down phase so that your body gets back to normal. You must keep fast acting carbohydrates with you. It's generally a common mistake to have chocolates during exercise when you feel low. Chocolates would not increase the sugar levels at that time due to the high fat content. It's very equally important to have proper footwear and a proper dress attire which will help you while exercising, especially in harsh climatic conditions. There are many barriers to exercise which many people experience throughout their life, which may include all these factors, even such as sweating, which could cause the dress to stick to their body, resulting in the itching thereafter, shame, racial and cultural factors, the cost of exercise, poor lighting, and probably not even enough space to do exercises. So it's very important that an effort from the patient side, as coupled with the proper advice from the healthcare professional and the medicines, all play an equal role in the management of diabetes. Exercise, as simple as walking, is going to be safe for everybody in whatever phase of diabetes you are. You just have to increase either the speed or the duration depending on your level of fitness. I hope you have understood about some of the basics about exercise. Always consult your healthcare professional before going on an exercise plan. Thank you.